Welcome back to HEAL, Health Equity and Advocacy Learning for Black People, created by Dr. Show. My name is Dr. Tosin. I'm a general practitioner and health educator. So you've been through some amazing educational modules thus far, from women's health to men's health, cancer risk, and much more. And I'm here to tie it all together and look at how we move forward. So this is appropriately titled From Struggles to Solutions, where we'll look at the next steps to eradicate Black health inequities. So let's start by taking a look at the mosaic of inequity. So what are some of the key themes in Black health disparities? Firstly, legacy of injustice. We can't overlook the centuries of systemic racism that has impacted the Black community when it comes to health, sadly creating a level of distrust within the healthcare system. Daily struggles. When we talk about racism and inequalities, we have to realize that there are daily struggles that people face, from economic disparities, limited education access, and neighborhood challenges. There is evidence that these daily struggles intensify daily stress, leading to chronic stress, which we know contributes to poor health outcomes and various health disparities. Barriers to care. There are disparities in access to care, to healthcare, and these services should be a point of equal access for all in the community. However, research over the years has shown inadequate patient access and poor patient satisfaction amongst patients from ethnic minority backgrounds. Toxic environments. We are battling environmental injustice. Polluted neighborhoods and lack of green spaces impact both mental and physical health, contributing to respiratory issues and cancer risk. Then economic hardships. Black people, as well as other ethnic minority groups, can unfortunately be disproportionately affected by socioeconomic deprivation, which is a key determinant of health status in all communities. Economic hardship breeds stress-related health conditions, just deepening these inequities that we see. And poverty and health challenges are really intertwined. Mental health struggles. Discrimination and chronic stress can drive mental health issues such as anxiety, depression, and PTSD. Educational disparities. So language and education plays a huge role in patient access, the patient journey, and continuity of care. Therefore, it's not surprising that education has been reported as a dominant factor in health inequity. Nutrition challenges. It's really the battle for healthy eating. And it's so important to highlight the scarcity of healthy food options and the lack of education around healthy eating forces unhealthy coping mechanisms, contributing to issues like obesity and heart disease. Next, justice system trauma. We have sadly seen over-policing, racial profiling leave lasting scars on individuals and communities, while incarceration strains mental health and deepens health disparities. And then community support. We really have broken social networks, and this can limit support options. Community is so important when it comes to healthcare and education and really building that trust around healthcare. Then systemic racism's toll. So systemic discrimination is not the behavior of a few, but is often supported by institutional policies and unconscious bias based on negative stereotypes. And this can add to stress and significantly shape health outcomes, contributing to chronic diseases and persistent disparities. Distrust and healthcare. This goes back to our first point on legacy of injustice. Centuries of systemic racism has unfortunately built mistrust within the healthcare system and mistrust of healthcare providers. And this can complicate the journey to care, entangling health disparities even further. So to summarize these points, the journey through the challenges and resilience of Black communities is more than just a story. It's a testament to the need for empathy, dedication, and an unwavering commitment to achieving health equity for all. The collective journey highlights the importance of dismantling health inequities and fostering a more inclusive and equitable society. So education and advocacy is vital when it comes to health equity. So awareness in education, it's so important to foster awareness, education, and advance cultural competency, which I'll explain a little bit more later. Policy and data. We need to champion policy changes and utilize data for precise interventions. New policies should be created to tackle these issues with ongoing quality research to further explore and monitor outcomes. Next, community engagement. We need to involve communities, empower youth initiatives, and really enhance health literacy. Health literacy is finding and understanding and using information and services to inform health-related decisions and actions for people and others. Collaboration for equity. Effective collaborations and partnerships are fundamental for engagement and the associated improvements in health and well-being to reduce health inequity. And then lastly, targeted data-driven solutions. Inequalities and disparities in healthcare are not a new problem, and strategies have been attempted to tackle such issues in the past, but the lack of progress has been limited. We need to focus research and leverage data for crafting precise interventions that address specific health issues. So, health toolkit for Black patients. Let's take a look at this. So we have put together a health toolkit to empower Black patients to be able to take control of their health. So what does this health toolkit look like? First of all, education. Educate yourself as much as possible when it comes to your health. Knowledge is power and the foundation to one's health. This can be done by using trusted sources such as the NHS website and speaking to healthcare professionals. Next, research and preparation. When it comes to your doctor's appointment, it's important that when possible, you go prepared. In England, the majority of GP appointments are 10 minutes, and that time is yours. It's a short time, but it's enough to get across your points and for your doctor to be able to help you. But to do that, it's better to go prepared. So write down what questions you have to ask the doctor and what your main pain points are, and that will go a long, long way. Self-advocacy skills. Advocating for your health can be really important. If you feel that you are not able to advocate for yourself, bring someone else with you to your appointment. Remember, your health is just that, it's yours. And always keep that at the front of your mind, especially if you feel that you're not being heard. Support network. Having a support network where possible is so important. This doesn't have to be friends or family members. It can be people that you share a common experience with, such as people living with chronic diseases. And in many communities, there are support networks already set up. Next, health record organization. It's really important that you're aware of your health records and you're aware of your medical history and you have all of that to hand so that when you're going to see your doctor or when you are possibly in hospital or going for your next appointment, you have your health record to hand and it's easily accessible. You know what medication you're on, you know your past medical history, and you know your family history. Next, research healthcare providers. If you're able to research your options and you know what options are available in terms of healthcare providers, this can go a long way. For example, there's the Black Asian Therapy Network, a group of Black and Asian therapists And for some ethnicity and cultural background, when it comes to therapy, is vital. So being aware of such organizations and healthcare providers can really change the outlook to your health and your care. Seek a second opinion. Remember that you always have the option to seek a second opinion, and it's there if you wish. Know your healthcare access pathways. If I was to ask who feels confident in navigating through the healthcare system, I'm sure not that many people would raise their hand. And it's so important to know where to seek help, for what, and the fastest avenues to be seen and the most appropriate avenues for being seen. One of the reasons why it's so difficult to see a general practitioner, or we have long waiting times in A&E, is because of the sheer demand, when actually you may be able to seek appropriate help elsewhere and possibly quicker. So being aware of the healthcare pathways is really important. Utilizing community resources. Community resources are really important, such as workshops or even exercise classes, and these may be available in the community that you live in. Providing feedback. Improvement can only happen via an analysis and understanding of what is going on and what is going well, and more importantly, what isn't going so well. And this is just a clearer roadmap and depiction of that health toolkit that you can use and you can remember. So let's look at a health toolkit for doctors and healthcare professionals, and what can you do for our Black patients? And here is a brilliant acronym for you to remember some key points. Bright care. Remember, we want the care for our patients to be bright. So what does this stand for? Well, B stands for bias, awareness, and self-reflection. The first step is taking time to reflect on your own practices and attitudes, and this is really, really important. Next, recognizing trauma and historical injustices. It's really important that we spoke about the centuries of systemic racism at the very beginning, and it's important to realize the impact that this can have on patients' attitudes towards health in healthcare. Next, inclusive language access. Language plays a huge role in patient access, the patient journey and continuity of care. Ensuring adequate interpreting services are available and really accessible is vital. I've been witness to many times that family members or even children have been used as interpreters due to the lack of availability, and this just isn't fair or safe practice. Gaining cultural competence. So what do we mean by cultural competence? It's about recognizing and gaining a knowledge of different cultural practices or views and being able to understand and communicate with people across cultures. Systems should be put in place for healthcare providers to recognize these potential barriers and provide robust policies to tackle them, such as cultural competence education, training, and programs. Next, health literacy promotion. So create and provide information and services people can understand, and this can build trust and better health outcomes. Targeted health assessments and screening. Targeted screening focuses on smaller groups that have heightened risks of conditions before screening. So for example, focusing health assessments for Black women during antenatal care, because we know that they are at a higher maternal risk. Next, collaborating with community organizations. So we've spoken about how effective collaborations and partnerships are fundamental for community engagement. Next, advocating for equitable treatment. We need to all do our part in speaking out. Relationship building with patients. We all know that the doctor-patient relationship should be one that is nurtured and based on trust. And lastly, education and training. And this is exactly what Heal Courses has set out to do, to equip doctors and healthcare professionals with the tools to recognize health inequities and uncover their root causes and proactively address them. As doctors, we have a duty of care to our patients, regardless of ethnicity, gender, age, and so on. So I encourage you as doctors and healthcare professionals to study these points and ask yourself how you can improve your day-to-day practices and encourage your colleagues to do the same. So thank you for listening today, and thank you to Heal Courses for putting together this incredibly important and powerful course. Utilize what you have learned and encourage others to do the same.